He's dead! He's dead! It's not a matter of if, but when the next pandemic will strike. And when it does, communities and emergency personnel need to be prepared for every eventuality.
Does anybody know sign language? Anybody?
That includes people from all walks of life congregating at hospitals. But during a pandemic, hospitals would be locked down under police guard. No one but the very sick would be allowed in, and that creates confusion.
I don't understand, like white coats and you guys have masks, like what's going on?
The result would be chaos and rising tension.
You think you can stop us? Yeah, let's go! You think you can stop us? Try me!
We're being assaulted! We have people entering the back of the truck!
Hospitals would also attract the desperate, people who would try anything to get to the doctors and nurses and the health care they can provide. One of the biggest challenges in preparing for a pandemic is handling the onslaught of visitors at a hospital. A moderate pandemic could result in up to 80,000 extra doctor visits locally over an 8-week period and up to 1,800 hospitalizations. Many in the healthcare field say we're long overdue for a pandemic. In 1918, an outbreak of the Spanish influenza killed an estimated 40 million people. Milder pandemics followed in 1953 and 1968. It's that history health professionals rely on when planning for the next big one.
History in more mild pandemics has shown, maybe 30% of the population will get ill. They may not all get ill at the same time. It's usually spread over an 8-week period. It may go away and then come back several months later. The first phase may be worse than the second phase.
The World Health Organization is keeping a close eye on the avian flu. So far, it hasn't been effective at spreading into large numbers of people. The concern is if it mutates. If it does, Warshawski says it will spread quickly because of our worldwide travel and the compromised immune systems of our aging population. But there have also been huge advances not just in medicine, but in our ability to monitor and track a virus in its developing stages. And that's key, especially in border cities like Sarnia and Windsor.
I think surveillance is the biggest thing. To know whether this disease or these pandemics are going to hit this area. And of course, we all know that if there was an outbreak in the U.S. or Canada, they would close the borders immediately.
In this scenario, lessons were learned. There weren't enough rubber gloves to go around. Communication between the 3 participating police forces was problematic, and members of the public order unit became contaminated with the virus themselves.
This is the benefit of doing a live training versus a tabletop. Tabletops, you don't see those things. You don't see the blood spatter. You don't see shields breaking and those types of things. So it lets us identify things in a controlled environment.
In Meaford, Kathy Mueller, A Channel News.